Hello and good morning, good afternoon to everybody. I'm really pleased to say that I've got Gracie and Amanda here today to talk to us about cervical cancer. Now, I came across these two lovely ladies when I saw an article about screening and how screening for cervical cancer has vastly changed and improved in recent years, and both of these lovely ladies work for a company called Zilico. Now, we're not talking about Zilico today, but we will just do a quick introduction about it. What we're really here to do today is to understand about why it's still so important to have a cervical screening, and why we have it, and why we should also tell all our children or our mothers or it is for these safeguards. But thank goodness in our country we're very lucky to have the opportunity to go and be reminded to go and have these screenings, and we have them all for free, which I think is it is brilliant, and we should all take advantage of it. So hi Gracie and Amanda, if we can kick off just a little bit of a little background about both of you, and then if you could actually tell us a little bit about Zilico and what you're doing, and then we'll go into the chat.
Yeah, of course. So hello everyone, I'm Gracie. I am a midwife. I've been working at the Royal Berkshire Hospital for about 7 years now. Sort of alongside my midwifery, I did sort of venture into some private work and did an acupuncture diploma, just looking at sort of other ways to help women throughout their experience, really. And then in July of this year, I started my new job at Zilico, working alongside Amanda. I'm very, very passionate about advocating for women's health and trying to sort of get past the stigma of women who feel embarrassed or shy to go and get a treatment or go and see the doctor for sort of a personal reason. So this is the perfect job to really try and push through and get people educated on what to do and how to go to screening and how important it is, really.
Great.
And I'm Amanda Caley. I work for Zilico as a clinical specialist, and I've worked within women's health for around 8 to 9 years. And before that, I was working as a clinical specialist in orthopedics and various other fields. And I became interested in how women are slightly differently treated within the sort of medical field, and wanted to really focus on helping women get timely care as quickly as possible and as smoothly as possible, with as much kind of focus on ensuring that they were treated the way they wanted to be treated and as expediently as possible, essentially. So that brought me to working in diagnostics in women's health, in detecting cancers earlier.
Cervical cancer, isn't it? We all hear about it, and then and it comes and goes in the press, and so we're going to talk about the Jane Goody effect. We're going to talk about the vaccines. So those have all been big news items, and then it all just disappears again. But it's like, how do you still keep people saying it's really important to go and regularly check? But I mean, should we first of all talk about the cancer, because it's not just one, there's a whole range, isn't it? So if you could just tell us a little bit about it, because I know that I've got loads of questions.
So in a nutshell, cervical cancer is the 3rd most common cancer worldwide, and over 3,000 women or people with a cervix have the cases of cervical cancer in every year in the UK. So over 3,000 women can have a case of cervical cancer. HPV is the main cause of cervical cancer. So there's many different strains. Some of these oncogenic, which in a nutshell basically is meaning that it can develop into cancer. So loads of different genotypes, and it's rarely showing any symptoms. So we could go around in society having no idea that we have HPV, which is why it's so important to go to your screening and make sure that if you do have HPV, that the solutions are which step is to be taken next, and to make sure that you're aware of how this is the only way that you're actually going to know whether you have HPV or not.
And I was just thinking, what age, I mean, I don't want to jump down because I know we were going to talk about Jane Goody a bit later, but what age is it they start? Is it 25 or have they made it younger yet?
So it is 25 that the screening process in the UK starts. So it's 25 to 64, sorry. But you'll be invited at around 24 and a half at the moment. So you should get your letters around then. But if you don't, it will come before your 25th birthday. And we'll touch on it a little bit later, but I cannot impress enough how important it is that even if you are 25 and you've had a vaccination for HPV at school, that is brilliant. You've taken the first step to protecting yourself and the people that you love. But it is still important that you go, because like all vaccines, nothing is 100%, and it could be that you weren't vaccinated against necessarily the particular strain that you might come in contact with at some point. You know, as Tracy said, 8 in 10 of us come into contact with a high risk HPV, which is what we call the oncogenic strains. So get screened if you can.
And are the screening there is every? I mean, I should know, but you know, I just wait till I get the text. Is it every 3 years? The screening.
Yes. So for 25 to 49 is every 3 years, and then it increases to 5 years from 50 to 64. And the reason for that is that we know that the highest chance of developing cervical cancer is sort of mid-30s. So it's definitely, it doesn't make sense to do it every 3 years for somebody who's older and hasn't got the chances of it progressing in 5 years is so slim at that age.
And Amanda, you said it was to 64. Is it what's 65 then? Clearly is a golden age. So what happens at 65? Is it they just think, oh.
So we know from statistics that from 64, 65 onwards, it's really unlikely that if nothing's happened so far on your cervix, that it's unlikely that anything is going to. You're sort of going towards the menopause, if not been through it already. So we know that it's less likely that you will have cervical change. That said, if you are unfortunate and you're 64 and you get the letter to say you need to go to colposcopy, which is where Gracie and I would work or do work, it may well be that you end up in the system for a little bit longer in order to make sure that you are completely clear of anything that's of concern or possible worry before you're then sent out. And of course, if you do have symptoms after your 64th birthday, do go and see your GP if you've got unusual bleeding or pelvic or lower back pain or anything that's of concern. Obviously, you know, do go and see your GP, because there's nothing to say that you can't be referred after that 64 mark. So it's just that the screening process within the UK obviously has to work for as many people as possible and not add to anxiety if it doesn't need to.
And do you know what the percentage uptake is? I mean, are we good in this country for going to have screenings, or?
It's quite different depending on where you are in the UK. It is reported locally. It can be reported by borough even as much as in London. We know that it's not as good as it was or has been, and that uptake has dropped. Now, that might be the effect of the pandemic and having less childcare, less availability to go. But we do know that it has dropped this year. And so obviously, if you're not screened, you can't tell what, you know, we can't see what we haven't got samples for. So we do know that it is dropping, and we would encourage people as much as possible to get screened. And that there is a lot of help out there from charities like Joe's Trust to do as much as they can do to help relieve anxiety. And if you've got any questions, do phone your GPs before you go for your, you know, what we would probably call the smear, although technically it's changed, and we'll talk about how it's changed. But there are things you can do, things that Gracie and I would suggest, and that what they would call smear nurses would suggest. Things like balling up your fists underneath your bottom to help lift up your pelvis can help with comfort. Lying on your side, asking your nurse, you know, ask for a female if that's what you want. Ordinarily, they are actually quite highly female as a workforce anyway. But if there's anything that makes you more comfortable and makes you feel more able to go and access that screening, even telling them about your background. If there's something in your background that means that you're particularly uncomfortable or anxious, then do phone them beforehand, and they will then, you know, allocate appropriate time to talk you through what's going to happen and make it as easy as possible.
And I suppose, I mean, it was it last year they released the amazing results that the vaccine reduced, hasn't it, the amount of cases. So do you think that could be something to do it? Because everyone thinks, oh, that's really good. It's, you know, it's all gone now. Don't need to go for smears. Do you think that could have an impact?
Definitely. I think, especially, I know from people that I know, there is definitely the people say, oh, you know, I've had my vaccine, I'm safe, I'm kind of invincible, you know, I'm lucky enough to have had it, and it doesn't cover every single strain of HPV. So it's still just as important to go and get checked. It obviously gives you an extra chance, and it's very, you know, you're very lucky if you've managed to have it, but it doesn't stop some strains that would not have been covered, and strains change all the time. You know, there's constantly new strains that we don't even know about some at the moment, so it's just making sure that we cover all avenues, really. And
I'm definitely obviously of a generation where it clearly wasn't available, but do you have to have, does it only work before you have your first sexual encounter? Do you have to have it before having sex? Yeah.
So we know, well, so far we know that it's more effective if it is used as a prophylactic, so before. That being said, there are European countries that offer it afterwards. There is trials ongoing in the UK about offering it afterwards and seeing its efficacy, whether or not it kickstarts an immune response. So that's ongoing at the moment. And there's one that's about to, I believe, release results, which will be really interesting to see. In the UK, you are still eligible for, I believe, an HPV vaccine up to your 25th birthday for free if you haven't had it already when you're in year 8, which is what they're offering at the moment. So boys, girls, anybody can get the vaccine in year 8, and if you miss it up to your 25th birthday, I believe you can still get it on the NHS for free. But yeah, the idea originally of the vaccines was to get to people before sexual activity.
Right. And that's interesting, because we were speaking earlier, it being for both male and female.
Yeah, so it's
presumably you can get it if you're a male.
Yeah, there's definitely less talk about it for men. I don't think it's something that most men would know about without educating them on it. But I think in the future, hopefully it will become pretty even, and it will be the same for men and women, and it's just as important that they get it than we get it, to be honest. You know, we both can spread it to each other through intimate skin to skin contact, so it is really important that we cover as many angles as possible.
So, I mean, let's talk more about the disease. How do we, yeah, how can we contract it?
Yeah, so it's passed on through intimate skin to skin contact. It doesn't have to be that you are sexually active. You could be just with a partner, or, you know, experimenting, whatever in any way that it can be contracted, even through the mouth as well, which is really important to mention. So I don't think people really sort of think of that as a sexually transmitted disease. So it's very, very easy to catch. And I think it's up to about 80% of people in their lifetime will contract HPV.
Really? Gosh.
Very high numbers.
But I suppose, as you said, you know, because you don't necessarily know you've got it, and it can just disappear.
Yeah, so it clears up within around 2 years. It should clear up. If you're healthy, things can delay that and slow that down. So if you're a smoker, if you've got low immunity, you're on chemotherapy, and generally sort of not very well, or fighting something off for a long time, like an immune deficiency, the virus might not clear on its own. But this sort of why Amanda and I were talking about, in 3 years, if you still have this virus, they will send you to colposcopy just to check everything over and see what's going on, if that is the case and you've still got it in your body within 3 years.
So is that my interference? Can you hear it at all? No?
I can't hear it.
But it must be my end. maybe it's my end. Okay, so we've looked at, there's lots of different types that we need to be aware of, and also to confirm that the vaccine hasn't always picked up all those variants, because there are so many, so why it's so important to carry on. So one of the things that we wanted to talk about was the advances, how quickly the screening has improved. I think we were going to do a short little timeline on explaining that.
Yeah, so just to also add on the HPV front, that it's not a sexually transmitted disease per se, so we don't check it in, or it's not checked in sort of gum clinics, or if you went for a usual sexual screen, it's not checked there. And the reason for that is because so many of us get HPV, and you can live with it and kick it out yourself. It's something that we can, as a virus, we can deal with as human beings, but we know that that the chances of it creating something like cervical disease or cervical cancer is higher. So that's why we check for it as a first marker. It's a good way of indicating those people that we need to take a closer look at. So briefly, we've had or there has been ways of checking cervical health since the 1920s, so around 100 years. So we have the Pap smear originally, which was a brilliant jump forward in terms of checking health. So they literally took cells from the cervix and smeared them across glass, and that's why it was called a smear test. Now, in some countries, that's still the case. That's still the gold standard being used, and it's a brilliant way of testing. But we know that it's not cheap. It's not a cheap test to do. We know that it takes quite a lot of time and manpower. So we moved in the 90s in the UK to what's called liquid-based cytology. So essentially a similar test, but a little bit more refined and with machinery added onto it, which made it more accurate. And then from there, we went to co-testing. So same liquid-based cytology, and then adding in an HPV test afterwards, potentially. And now we've moved to HPV, what we call HPV primary. So for some people, they will have only just had smear tests that is using this system, so it might look different. So you might have forever had a normal smear test and now come with an HPV result coming back, and that's not anything. It doesn't mean that necessarily you've only just got it, so you don't need to panic necessarily. Well, you don't need to panic at all, because cervical cancers mostly are quite slow growing, so we know that we can treat them really effectively if they're found, which is why we have such a robust screening process in the UK. So now we do the same thing as we would have done for your last smear test. So a small brush is used and a speculum, and it goes round the cervix, and that takes some cells off the cervix, so the neck of the womb, so the bottom bit of the womb, top of the vagina. So we take a sample, and that's tested for HPV. So if you have one of these high-risk HPVs that we were talking about, the ones that we know are more likely to cause cell changes and to sort of kickstart cell changes, which we don't want to see, then that sample, that same brush, will be used to test with that liquid-based cytology if there's any cell changes. So if somebody sees that there is cell changes, then at that point you would get a letter to say you're going to be referred to colposcopy, please come to the hospital, essentially, and we'll have a closer look. So we can talk a bit about colposcopy, because I think often we talk a lot about going for screening, but not necessarily about what happens after that stage. So if you're unlucky enough to have that, do go to colposcopy, because it's like the same as a smear, but in a better chair. It's slightly more, it's slightly less scary in some ways, because these people do it day in, day out. So it is exactly what they look at all the time. So it should be not so weird, maybe, hopefully. If, on the other hand, you take that smear, you go to your cervical screening or smear, sort of two words for the same thing, essentially. They will check for HPV. They'll then look to see if you've got any cell changes. If you don't have any cell changes, then that's brilliant. They'll call you back in a year. So they'll send you a letter to say that you have high-risk HPV. Again, 8 in 10 people get this. It's not the biggest thing in the world. You might have had it for some time, because you might just have been in an area that has only just moved to this particular testing system. And if you don't have cellular change, then they'll ask you to come back to your GPs in the year and retest you to see if you still have HPV, because the likelihood is that you'll manage to kick it out, especially if you're eating an apple a day and you're doing all the right things. And quitting smoking is one of the best things that you can do to stop cellular changes, because we know that smoking does inhibit cellular repair. So if you can access as much information as you can for your GP, if you can possibly bear it, try to stop smoking, and that will make a huge difference. If you then go back and you do have cell changes, then you'll probably be asked to go into colposcopy again in a hospital setting to have a closer look. And that is literally to see with eyes. So a clinician can see with eyes, or any extra diagnostic systems like Z-scan that they might have a look and see if there is anything that's of concern and anything that needs potentially to be tested more carefully. So a small sample might be taken, a little pinch of skin, or a larger sample if required, but your clinician will tell you a bit more about that when you get down the line.
No, I mean, it's fascinating, isn't it? Because, I think you do get concerned about, I've been called back in, but I think you've been very reassuring by saying it is so common not to worry, but for goodness sake, go back in. And that other thing is that, they're dealing with, and I think I always feel that we want to say to people that, when you go into hospitals, you are not the only person. They have seen so many people. There's no need to feel embarrassed or whatever it is, but one appreciates it is because it's maybe the first time for yourself to go in, but it's a tricky one, isn't it?
Yeah, and I definitely think that people scare people quite a lot. So they'll say, it was terrible, I was in so much pain and I didn't get warned about this and that. And it's just not the case at all. Obviously, Amanda and I see so many clinics in so many different hospitals, and they're all, they've all got they're all very similar in how they always get consent. Nothing is rushed. There's normally another person in the room, normally a nurse or a healthcare assistant, who's always there to say, do you want my hand? Are you okay? And they're sort of like the caring people that you have in the room. And you do have the option of having somebody with you as well if you want to. But it's definitely always the thought. And then they go in and then afterwards they go, this wasn't too bad. This was okay. And you hear that like 90% of the time people say, that was absolutely fine. And it is just, they get so worked up about it. And it's really not as bad as people think it is.
And also you then get the peace of mind that you've actually done it. And if there is something there, well, thank goodness they found it earlier rather than later. I think that's for sure. So we've spoken about what happens if you get a recall. We go into the doctors and this is what they do. One of the things that we put, and in particular, we mentioned about your medical device, and as I said, this isn't a sales talk, because obviously it's not as if we're going to go out into the street and go and buy your device. But what's interesting is the new technology that you've got, because I think it's something, I'm just trying to remember what you explained before, because it is quite new and it's less invasive for people if they don't need to go back again, isn't it, for another scan? If you want to expand on that.
Yeah, so Z-scan is a new piece of what's called adjunct technology. It's used at the point of care of being in a hospital. So if you were called to colposcopy, you might be offered adjunct technology. So they will have a look, do an original colposcopy. So they use some dyes which they put onto the cervix, a little bit of vinegar, and that changes the color of the essentially skin on the cervix. So the cervix looks a lot like the inside of your mouth. Slightly pink, and if you put vinegar on it, we can see different color changes, and that indicates where there might be an area of concern for us to look at. So and that's grand, but as we say, the efficacy of HPV vaccines has meant that some cell changes don't change or don't sort of present in the same way as they potentially used to for clinicians. So there's some sneaky things happening that we might not necessarily always see. So Z-scan uses electrical impedance. So essentially, is it difficult to put a little tiny bit of electricity through cells or not? And we can measure that. It's completely painless because it's set at a frequency that you wouldn't feel it. And they go round the cervix. The cervix looks something like this. They go round the cervix, and then it gives them more idea of what's going on, and they can show you a traffic light system. So green is good, and then there's an orange and a red, which indicates to the consultant or the clinician that's working with you where they might need to take potentially a sample of tissue to see if there is anything more going on that needs some more attention. And on those, sometimes they will biopsy a patient just to rule out that anything is going on. So if you get a biopsy, don't always let your mind rush to that, oh, this is the worst thing in the world. Actually, often they're biopsying or taking a small bit of tissue because they want to check that everything actually is 100% of what they think it is, because that's really the only sort of not foolproof, but that's the only way that we can really sort of belt and braces tell. So Z-scan will help reduce the number of biopsies that they have to take potentially, and also it can give you reassurance that actually all is well. A clinician has said all is well, a computer has said all is well. So it just adds in a layer of efficacy and confidence.
That's good. I know I've been jumping around, but I'm sort of aware that we've been jumping around as well. The one thing is that we didn't speak about the Jade Goody effect as to, how it was positive, but actually now not so positive.
Yeah, so I think obviously we all knew Jade Goody from the TV, and having somebody so young and the changes that happened to her so quickly, which she obviously was openly sharing with all of us, I think shocked everyone, and it kind of put into reality this really can happen to anyone at any time. She had a lot of gynecological issues throughout her life, which were looked at, and sometimes she was treated for them, but she was kind of misdiagnosed near the end, and she just had, the care that she had was not what it should have been, and through the misdiagnosis of them saying, oh, she's just got very heavy periods, all of these classic symptoms of cervical cancer that she did have were missed, which is obviously deeply sad, and she shared all of that with all of us. And I think initially we all responded to that and all thought, right, we need to go get our screening, and everyone was very conscious and aware that if they hadn't done it in time, they needed to book it. But slowly we've kind of reverted back to our original ways, and as Amanda said earlier, the HPV vaccine as well is another reason that I think people have sort of not taken it as a priority. And I think it's kind of, a lot of people say, oh, I've got my smear, and they sort of put it to the back, and actually it has to be a priority in the diary. It has to be something that needs to be done as soon as when you get that letter through, and even things with work and things like that, being able to have a time in the afternoon to go and have that done, and it not be difficult to go and get your screening test done, is really, really important.
And I suppose, but also one should always, all the time, be attentive to what is going on, as to what is normal for your body and what's not normal for your body, and as everybody's different, aren't they? So
yeah, definitely.
I think if you notice any changes, I think it is important, even if you're outside of that kind of frame of, even if you're younger than 20, 21, if something very unusual is happening for you, 24 or 25, if something very unusual is happening for you, then, do go and speak to your GP about it, because there may be something going on. It's very unlikely below that age, but better safe than sorry, certainly, to have a check. And the other thing on the time front that Gracie just mentioned is to say that getting time off work is incredibly difficult. We all get that, and obviously the timings don't always work. It is worth, if you're in a position and you feel you can, there is a time to test program or campaign that Joe's Trust run, and works can sign up to that time to test, and it's essentially giving you time from work to go and get diagnostic tests, not just cervical screening, but breast checks, prostate checks, any kind of checks that you need. So if you're in a position to get your work to sign up for it, then that is well worth doing.
And I have to say, Joe's Trust is great because it has so much detail, doesn't it? And it does cover all the different gynae cancers, as opposed to just one cancer, which a lot of them do. It does cover all of the range, you know, that we don't always talk about. I can't remember if there's 5 gynae cancers or 7 or something. Can't remember now.
Yeah, so the Eve appeal covers all 5.
Oh, the Eve one, yeah.
Yeah, and they often talk about gynecological cancers, sort of, endometrial cancers, those sort of things, vulval cancers, which are all slightly different and quite hard to diagnose because as women we are all markedly different, complex creatures.
Yeah. And also when you age as well, and I think when you know, if you're going through stress or you trying for a baby or had a baby, your body changes every time, doesn't it?
Definitely, huge changes, huge changes. And I suppose you can put some things down to hormones and, you know, irregular bleeding and things like that. You could put down to hormonal changes, or just generally just push it aside and just say, oh, you know, it's just because I'm a woman. And yeah, it's just being conscious and aware of your own body, and, you know, making sure you look after yourself and put yourself first. And health is so important, but it seems to be something that we don't really take enough notice of.
We did have a question. Actually, before we go on to questions, if anyone has got any questions, please just post them now. But have we missed anything that we wanted to say about screening at all? Is there any important messages we've missed, do you think?
I don't think so.
No.
I mean, attend if you feel able, talk to your screening provider, do call them up if you need any help attending. I think the patients that people tend to worry about most are the people that don't attend when they're asked to on subsequent. So well done for getting to your smear test if you go, but if you do get invited, do try and attend that, even if it's just to attend to say that you can't cope with it. Do try, or phone reception and ask them to help you, because those are the people that really do need to be seen. There's probably nothing wrong, but if you're not seen, you never know. So you might as well open the box and just check, because then we can deal with it before it becomes a bigger problem. So that's probably my leave.
So the question that we got asked, we did get asked a couple of very much general ones, which I know that we've already answered. But one lady emailed in, please can you talk about whether women who've never had any sexual need to be screened, and also the options for housebound people? I find these things are almost never talked about, but there's 3 separate things there which are quite interesting. But first of all, it's the sexual side of it.
Yeah, so I suppose it depends on what you're classing as sexual contact. HPV can be passed between people on toys, for example, sex toys, for example. Also kind of just intimate touching, or as Gracie said, HPV also lives in the mouth. So it's not necessarily full penetrative sex that we're talking about in terms of passing HPV. So we know that you're less likely to have HPV if you're not in any way sexually active, but we also know that it's so important, if you can, to access screening, because there are a very, very, very small percentage, in fact, a 0.5% or so of cervical cancers that are attributed to non-HPV related causes. So it is still worth going if you can possibly do it. But you know, there are lots of reasons why people might not access. And as I say, access information on Joe's Trust, and call your provider if you feel you need more advice from them. They will give you that advice as well for your own individual position and circumstance. And in terms of homebound people, that is still an incredibly difficult area. There is self-sampling being trialled at the moment in some boroughs in London. Self-sampling is being trialled quite widely. It's not something that's routinely done in the UK as of yet, but that doesn't mean that it won't be. So again, if you are homebound and you get invited, call your provider and ask if there is anything that they can do for you. You might find you are in an area where they can do that. And that's not about a postcode lottery, it's more about availability of tests and making sure that we have something which is as accurate as possible. But it's definitely worth talking to your provider about, and it probably is where the future will be, but not quite yet.
Well, thank you. So, I mean, I think we've rattled through that much far quicker than I thought we were going to. But yeah, really fascinating. So just like to say thank you so much, both of you, for your time. And yeah, we'll post the webinar up, and hopefully people have got the message. Please keep going to your screening, and particularly if you've made the effort and you've been called back, that's when you really need to go back in to see it, and nothing to be frightened of at all. I think you said, is it 8 out of 10 are absolutely fine anyway?
8 out of 10 people have HPV or get HPV in their lifetime, and the majority of it turns out to be nothing.
Yeah,
it's always worth a check. Yeah.
Brilliant. Thank you so much, and thank you everyone for joining us. Cheers.
Thank you.
Thank you.
Bye.
Bye bye. Bye.